If you're over 60, there's something sitting in your medicine cabinet right now that could be quietly putting your heart at risk, and you probably have no idea. It's not some dangerous street drug. It's not an experimental medication. It's not something rare. In fact, it may be something you took this morning without a second thought. And that's exactly what makes this so dangerous. Welcome back to Dr. Michael Healthy, the channel where we uncover the hidden truths about aging, heart health, and the everyday habits that could be helping or hurting you. Today, we're talking about 5 incredibly common medications that many older adults use regularly, medications that are often considered safe, but in certain situations can place serious stress on your heart. This video is not about fear, it's about awareness. Because once you know what to watch for, you can ask better questions, make safer choices, and potentially protect the most important muscle in your body. Let me be very clear before we begin. This video is not telling you to stop taking your medications. Never stop any prescription or even regular over-the-counter medication without speaking to your doctor first. Every medication has benefits and risks, and the goal here is not panic, it's empowerment. If you're over 60, your body processes medications differently than it did at 30 or 40. Your kidneys may not clear drugs as efficiently. Your blood vessels may be stiffer. Your heart may already be working harder because of age, blood pressure, or previous health issues. That means medications that seem harmless to one person can be far more risky for someone else. And today, I want to help you understand exactly which ones deserve a second look. Let's start with one of the most common and most overlooked dangers in American households, NSAIDs, or non-steroidal anti-inflammatory drugs. These are pain relievers like ibuprofen, naproxen, and diclofenac. Millions of older adults take them for arthritis, back pain, joint stiffness, headaches, and everyday aches. They work fast, they're easy to buy, and they're available without a prescription. That convenience makes people assume they're harmless. But for many adults over 60, regular use of these pain relievers can quietly put enormous strain on the heart. Why? Because these medications can cause your body to hold on to extra salt and water. That means more fluid in your bloodstream, which means your heart has to pump harder. If your heart is already dealing with age-related stiffness or high blood pressure, that extra load can become dangerous. NSAIDs can also raise blood pressure and make blood pressure medications less effective. So even if you think your hypertension is under control, these pills can work against you behind the scenes. And if you already have heart failure, coronary artery disease, or kidney problems, the risk goes even higher. Some people notice swollen ankles, sudden weight gain, shortness of breath, or unusual fatigue, and they think it's just aging, but sometimes it's the medication. If you use pain relievers often, don't assume they're harmless just because they're over the counter. Ask your doctor if acetaminophen, physical therapy, stretching, topical pain creams, or lower dose short-term use would be safer for you. The rule with NSAIDs after 60 is simple. Use the lowest dose for the shortest time possible and only when truly necessary. Now let's move to a medication category that surprises a lot of people, because these are often called stomach protectors. I'm talking about proton pump inhibitors, or PPIs, medications like omeprazole, pantoprazole, and lansoprazole. These drugs are commonly used for acid reflux, GERD, ulcers, and indigestion. They can be incredibly effective, and for short-term treatment, they're often very helpful. But the problem is that many people stay on them for months, even years, without ever revisiting whether they still need them, and long-term use may come with hidden cardiovascular concerns, especially in older adults. One of the biggest issues is that PPIs can lower your body's ability to absorb magnesium, a mineral your heart depends on for stable electrical activity. Low magnesium can increase the risk of irregular heart rhythms, palpitations, and in some cases, dangerous arrhythmias. That means a medication you take for your stomach could indirectly affect your heart's rhythm over time. There's also concern that some PPIs may interfere with the body's nitric oxide system, which helps keep blood vessels flexible and healthy. While research is still evolving, several studies have raised concerns about a possible association between long-term PPI use and increased cardiovascular events. That doesn't mean everyone should stop them. It means they should not be taken mindlessly forever. If you've been on a PPI for a long time, ask your doctor, do I still need this? Could I step down the dose? Could lifestyle changes help? Should we monitor my magnesium? Sometimes simple changes like avoiding late-night meals, reducing trigger foods, losing a little weight, or elevating the head of the bed can reduce reflux and reduce dependence on these medications. Now here comes one of the most dangerous categories for seniors during cold and flu season: oral decongestants, specifically medications containing pseudoephedrine or phenylephrine. These are found in many popular cold and sinus remedies sold at pharmacies across America. When your nose is stuffed up and you can't breathe, they can feel like a miracle. But for older adults, especially those with high blood pressure, irregular heart rhythms, heart disease, or a history of stroke, these medications can be a serious problem. And the reason is simple: they constrict blood vessels. In your nose, that helps reduce swelling so you can breathe. But they don't just act in your nose, they act throughout your entire body. That means blood vessels tighten, blood pressure rises, and the heart has to work harder against that extra resistance. In some people, this can cause a sudden spike in blood pressure, a racing heartbeat, palpitations, dizziness, or even trigger an arrhythmia. Imagine already having an aging cardiovascular system and then adding a stimulant that tells your blood vessels to clamp down. That's why so many cardiologists tell older patients to be extremely careful with cold medicines. If you're over 60, always read labels. If you see pseudoephedrine or phenylephrine, stop and ask whether it's really worth the risk. Safer options may include saline nasal spray, steam, humidifiers, warm fluids, or doctor-approved nasal treatments that act locally instead of systemically. Never assume a cold medicine is harmless just because it's sold on a shelf. Now let's talk about something incredibly important, because this one involves both emotional and physical health: older antidepressants, especially a class called tricyclic antidepressants. Medications like amitriptyline and imipramine are older drugs that are sometimes still used for depression, but they're also often prescribed for nerve pain, migraines, insomnia, or chronic pain syndromes. And while they can help certain patients, they can be much harder on the heart than many people realize, especially in older adults. As we age, we become more sensitive to medications that affect blood pressure, balance, and the heart's electrical system. Tricyclic antidepressants can lower blood pressure when you stand up, causing dizziness or fainting. That alone is dangerous because falls in older adults can lead to fractures, surgeries, and life-changing complications. But beyond that, these medications can also affect heart rhythm and conduction. In simple terms, they can interfere with the electrical signals that tell your heart how to beat properly. That can increase the risk of abnormal rhythms in some patients, especially if they already have heart disease or are taking other medications that affect the heartbeat. They may also increase resting heart rate, which places more stress on the heart over time. That doesn't mean these medications are bad for everyone. It means they require caution, monitoring, and a very thoughtful risk-benefit discussion. If you or someone you love is taking a tricyclic antidepressant, it may be worth asking the doctor whether a newer alternative could be safer, especially if there's dizziness, fatigue, palpitations, or a history of heart issues. Mental health treatment is essential, but the treatment should support the whole body, not create new risks. And now we come to the most controversial item on today's list, one that surprises almost everyone: calcium supplements. For decades, people were told that calcium was the answer to aging bones. Take calcium to prevent osteoporosis. Take calcium to keep your bones strong. And while bone health is incredibly important, the story becomes more complicated when we're talking about high-dose calcium supplements, especially when people take them on their own without medical guidance. The concern is usually not calcium from food. Calcium from foods like yogurt, milk, cheese, leafy greens, and fortified products is absorbed gradually and used more naturally by the body. The concern is when a person takes a concentrated calcium pill that causes a sudden spike in calcium levels in the bloodstream. Why does that matter? Because some researchers believe that in certain people, excess calcium from supplements may contribute to arterial calcification, the hardening and stiffening of blood vessels. When calcium deposits build up in artery walls, the arteries become less flexible, and that can increase cardiovascular risk over time. Some studies have suggested a possible link between calcium supplements and a modest increase in heart attack risk, while other studies have found little or no clear effect, so the science is not completely settled. But what is clear is this: calcium supplements are not something older adults should start casually just because they saw a commercial or heard a friend mention it.